case number 3, a 50-year-old man referred for repeat ablation of these ectopics. What's the likely origin of these ectopic beats? I will explain the findings after a few seconds. The correct answer is the parahis region. So here we have sinus rhythm with right bundle branch block and a long PR interval, and PVCs. The PVCs have a right bundle branch block like configuration, relatively low amplitude R wave, and concordance across the precordium with dominant R waves across the precordium. The frontal plane axis is directed inferiorly, but almost isoelectric or slightly negative in lead 3. And you see that there is a dominant monophasic R wave in AVL, consistent with a vector that's pointing towards left shoulder. And this configuration has been associated with Parahisian PVCs. So the His region's a little bit lower than the rest of the outflow region, hence that frontal plane axis. In this patient's story, he's had a prior failed ablation, and you see that he's got right bundle branch block with a long PR interval in his sinus rhythm beats, making you concerned that perhaps that prior ablation injured his conduction system, AB node, as well as the right bundle.